So what we're trying to do is determine where are we in the arc of the health crisis and professional sports. And to help us along with those questions, we do have Dr. Celine Gounder, whose bona fides include being a member of President Biden's task force on COVID, as well as Jerome Pickett, Senior Vice President, General Manager of Sports and Entertainment at Clear. Now, Celine, I want to start with you. You and I got connected through your husband. He's the soccer writer, the noted soccer writer, Grant Wall. The question I have for you at the outset is, what is the relationship between the public health personnel and sports, considering that a soccer game, a Champions League game in Italy, might have been the first super spreader event? Are they in conflict in that you have an industry trying to get fans back in arenas, while, of course, we still have a health crisis going on?
Sure, and it's great to be here. And it was an honor to serve on the Biden-Harris Transition COVID Advisory Board. Our work as an advisory board came to an end with the transition, but many of us are still very much in contact with the administration as well as with others on the ground. I think, unfortunately, the conversation has been very much, is it public health or the economy? Is it public health or a particular industry? And public health officials, public health science are really here to help reopen the economy and to do so safely. But that does mean being transparent around the data, not burying our heads in the sand, and following scientifically based guidance and advice. So we have been in very close communication throughout the transition period with all of the different sports leagues, understanding what their concerns are, understanding what is working, what's not working, trying to share some of those best practices with others, and trying to figure out how to move forward now that we do have vaccines available, and what the coming months will bring.
Very difficult question, I know, but can you synthesize where are we in that arc of full arenas, full stadiums, when we do have vaccines, yes, but also lurking now, we have these variants of COVID?
Yeah, and I don't know if all of your viewers will be aware. So all three of the variants, you have a variant coming out of the United Kingdom, one from South Africa, one from Brazil. All three have now been detected in the U.S. Most recently, the South Africa variant has been reported in South Carolina, and these are people who did not travel. So that means there is community spread of that variant, at least in South Carolina. So they're all present here in the United States and are very much our problem. The CDC is now predicting that the UK variant may well become the dominant strain here in the United States by March. And I'm just going to break down quickly for your audience why we're worried about these. The B.1.1.7 UK variant is concerning because it's more transmissible, more contagious, which means it spreads from one person to another more easily. So even if it's not causing more severe disease, if it spreads more easily, it means you have more cases, more hospitalizations, more deaths. And there is now some recent data just reported on Friday of last week that it may in fact also cause more severe disease, and that's something that's still being studied. The other two variants out of South Africa and Brazil, we have some slightly different concerns about. So looking at the immunity from natural infection, we are clearly seeing reinfections in the case of these two variants, and we see that more generally as well. But in addition, we are seeing decreased effectiveness of the immune response to the vaccines in the face of these variants. So I think one key thing to understand is the vaccines remain effective. It's just that they're not quite as strong. So let's say, for example, you started off at a strength of 100. You've now dropped to maybe a strength of 20 when all you need is a strength of 5. So we're seeing a trend, and it's the trend that's concerning because it means if you continue to have mutations, that new variants arise, that in the future, the vaccines may not be effective. And so Pfizer, Moderna, they're already looking at how to tweak the current vaccine to be effective against the new variants. AstraZeneca and Johnson & Johnson are looking at how their vaccines will be how effective they will be against these new variants. And big picture, the most important things we can do to prevent further spread of these variants is, one, to roll out vaccination as quickly as possible in this country, and two, the other things that we know prevent transmission, which are masking. This is why you may have seen Dr. Fauci on the news talking about double masking. A single cloth mask is, especially a single layer, is not as effective as a triple layer mask. Surgical masks are even better, and KN95 and then N95 masks are even better than that. But we really need to be doubling down on masking to prevent transmission. We need to be doubling down on sticking to household bubbles. If we're going to socialize, to do so outdoors over indoors, improving ventilation, all of the things we've been talking about. Because if you allow these variants to spread, we may find ourselves in a situation in the fall where there is a gap in terms of vaccine-induced immunity. And that's the last thing we want to see happen. And again, the more you let it spread, the more it mutates, the more you run into that problem. So, I think the next couple months are really going to be very important in terms of predicting what the fall looks like.
Jerome, let me bring you in with this piece of data. 62% of the folks that we polled show that they believe you should have to show proof of vaccination to enter a sports facility. Rather than, we have a thing, a dogma in journalism, show, don't tell. Rather than tell people what Clear does, we thought it would be easier to show them a demonstration of what Health Pass is.
Sure. Yeah, let's play the video.
Clear Health Pass offers you and your customers the confidence to move forward. Health Pass securely links definitive identity and health, making everyday experiences safer for all. Meet Jane. She's eager to cheer on her favorite team at the stadium, get back to her favorite restaurant, and even get back to the office. Health Pass is the solution for your business to allow safer access, while providing Jane the confidence to get moving. Jane downloads the Clear app for free and enrolls in a few quick steps from the comfort of her home. Jane adds an ID, like a driver's license or passport, snaps a selfie, and confirms she's a real person in a flash. With the ability to link to health providers and lab results, as well as tickets, reservations, and building access cards, Clear Health Pass is what Jane needs to move through the world, making her unstoppable. Jane is now ready to enter any participating venue with Clear Health Pass. Here's how. Jane opens the Clear app and verifies her identity with a photo and real-time health insights. Clear's developed touchless technology can take her temperature and confirm Jane is Jane, so she can walk in with confidence. And because Clear is platform agnostic, scalable, and easily integrated, Clear Health Pass can generate a QR code to scan on your existing hardware to keep Jane and the rest of your customers moving. And best of all, as the trusted leader in biometric identity and access for over 10 years, you and your customers will rest easy knowing their privacy is protected and their data is safe and secure. Always. Clear Health Pass, giving you and your customers the confidence to move forward.
So Scott, one of the things I learned from the NBA bubble when I was chief security officer for the National Basketball Association is the power behind the convergence of testing strategy, layered in with technology, layered in also with a shared vision and a shared expectation of what that environment is going to be. What COVID has done, and it's really accelerated in venues the infusion of technology, and it's really accelerated what fans will expect as far as how they will consume content and also how technology will work. Clear is able to build a platform, it's called Health Pass in the video that you just saw, that pulls in all of the elements that you saw deployed in the NBA bubble. It actually was deployed in NHL's bubble, and it resulted in 0 positive tests over the 2-month period for the NHL bubble. So we're returning fans are going to expect to see changes when they come to the arena. They're going to want to be in a safe and healthy environment. They're going to want to know that when they go inside this environment, that their health was validated, whether it's through health attestations, through COVID test results, and then also through validated vaccine results. And what Clear does, it's a secure identity platform. It appends you to your data. It appends you to validated test results. With Clear, you're your ID, you're your credit card, you are your COVID test results and your vaccine validation results. So what we'll expect is shorter lines, no lines, frictionless experiences, cashless payment. These are all things that fans are going to expect and are expecting to come back and have confidence in the environment that they're going into.
What are you hearing from the leagues and the teams in terms of how fast can we get it, and what else can we get in terms of keeping fans safe? Because they're looking at the same data we are. What's going to keep fans away is the fact that they're just scared they're going to get sick.
Yeah, so the leagues are all taking different approaches, and there's different problem sets that they have to solve for: indoor versus outdoor, fans close to the action, further away from the action. And even as you go to outdoor sports like NASCAR and golf, there are certain areas that you do need to have verified health insights to keep people safe when they're close by. So, Clear can be deployed rather quickly. It's hardware agnostic. You don't need to have pods, and you don't need to have anything other than the Clear Health Pass platform. And we are embedding into ticketing platforms as well, into concessions as well. So what Clear will do is be able to provision for any guest all of the experiences that you want to offer that guest inside that venue.
Celine, let me ask you, we heard from Adam Silver not long ago that he's in discussions with the Biden team about possibly getting players vaccinated as means of a public service announcement, because there is some reticence. Do you favor athletes, let's say LeBron James, for instance, because of his notoriety, being pushed to the front of the line, but in a public service way, and that it would encourage others to get vaccinated as well?
Look, I think anything we can do to address vaccine hesitancy is important. And there are three main populations in which we're seeing that. We're seeing that in communities of color, in particular African Americans and Indigenous Americans, because these are the populations that have the longest history of abuse by the healthcare system and medical experimentation. So there's very much a history that it's quite reasonable that they would be distrustful of the system here. The other two groups where we see a lot of distrust and vaccine skepticism, hesitancy, is among rural Americans and right-wing partisan Americans. And so each of those will require a bit of a different strategy. I do think there is a role for messaging and PSAs. I do think we have to be a little bit careful. And I've been working with a few different groups that are doing surveys to see what kind of messaging, what messengers will work best. And one of the things I have heard is that you have to be a little bit careful using celebrities. They really need to be paired with doctors, other healthcare providers, scientists from the community in doing the messaging, because there is a bit of a backfiring effect where some of these communities are saying, well, so you're going to message to us using a celebrity, but you're going to message to white soccer moms with Dr. Fauci. And so you do have to be very careful how that's done. So I think pairing that kind of messaging with, for example, Kizzmekia Corbett, the African-American woman who is the head of the coronavirus vaccine development program at NIH, pairing leaders like that with a LeBron James, I think that is what the survey data shows to be most effective as a strategy.
Take me, if you will, inside the conversations that are happening between public health officials, both at the national and local level, and which is more important? Do you need the local with the local team, or do you need both with teams and with leagues? How does that go?
Yeah, you really need both. And I think and from some of the survey data that has been gathered, and it's remarkably actually consistent across different research groups, the data that they're getting back. A lot of people who are hesitant really want to feel heard. They want a two-way conversation. And that's very difficult to do with a nationally broadcast PSA on television. People are hearing the message, but they're not really having a chance to feel heard. And so I think enlisting local teams, people who are really embedded in the community, it could be the local high school football coach, but somebody who really is able to have an exchange. Maybe it's a Zoom town hall for the high school where, parents have a chance, teachers have a chance, and so on, to ask their questions. That piece of it is really, really important. And so the more that we can enlist leaders in the sports community, and they can be high profile national leaders, but I think very importantly, local such people as well is really important to the effort here.
Jerome, give me a glimpse into the rate of adoption from teams. I'm assuming that it has increased in the last year or so for Clear as well as other providers.
Yeah, no. So we've been able to execute league level deals with the major leagues, NBA, NHL, NFL, and we have seen a big increase in adoption as far as the number of teams that are bringing on Clear as a platform. Of course, there are some teams that are not yet able to host fans. So we do have a number of venues that we are deployed for employees. It's always a great way to be able to test out the platform and operationalize it, in planning for when your fans do come back. It's a much more smooth implementation for the fans, but we've seen growth across all of the different leagues.
If I owned an NBA team, for instance, I said, Jerome, I want my arena outfitted, I want the practice facility, what's the cost?
Well, it's the cost is based really on fans. It's approximately $1 per person. It's free to the guest. It's free to the fan. It is a business. It's a B2B model that we have. It's roughly $1 per person is what it comes out to. But it does vary a little bit depending on league and attendance. So it's roughly $1.
Celine, do you get the sense that fans, and I know owners are probably taking a more cautious approach, but I'm hearing from fans, and the data shows that there's a big push for this return to arenas and maybe Q2, Q3 of this year. Is that overly optimistic?
Well, I suppose it depends on a couple different things. One, we do not yet have data on whether the Pfizer and Moderna vaccines, or for that matter, the others in the pipeline, prevent transmission. They prevent severe disease and death. We think they will probably prevent transmission, but that is data that is currently being gathered as vaccination is scaling up. And that's going to be really important as to whether people can gather safely in a stadium unmasked. I think at least for the near term, even if somebody is vaccinated, the recommendation continues to be that they should mask. And the reason is that even if they themselves are protected against severe disease and death, it is still possible, we just don't have the data yet, that they could be infected, that they could have a low-level infection where they could be transmitting onto others. And that is the purpose of wearing the mask in that situation. I think the other issue is how quickly will the vaccines get rolled out. And as I think people have heard, the president wants to get 100 million shots into arms in his first 100 days. There have been another 200 million doses purchased from Moderna and Pfizer. The plan is to try to get those distributed by the end of the summer. But given that those are 2 doses per person for those vaccines, 300 million doses total is still 150 million Americans. And that's less than half of the 330 million Americans in this country. So we're still not going to be reaching this quote unquote herd immunity threshold by late summer. So, I do think some of the solutions you're describing, for example, the Clear solution, if you're able to really focus on people who have been vaccinated in these venues and possibly still are requiring some level of masking, that's probably what this will look like come late summer, early fall.
Yeah, I know there are at least some owners who have said that they're really already looking to next season. There's just too much uncertainty right now to realistically believe that there will be any significant number of fans. It sounds like they're probably smart to be thinking that way.
Yeah, I would agree with that. I think, there's a lot of uncertainty, and it really hinges on so many different factors. Possibly, things will happen more quickly. Johnson & Johnson is going to be submitting their clinical trial data to the FDA probably in the next couple of weeks here. So possibly by the end of February, we'll have a third vaccine available with an emergency use authorization. Then you have AstraZeneca and Novavax coming after that. But there's a lot of ifs. We haven't seen the data yet. It depends on if there are any obstacles with manufacturing. In the case of the Moderna and Pfizer vaccines, there are certain raw materials that are in limited supply, and that does constrain the speed at which you can manufacture doses. And we're not entirely sure if we're going to run into similar issues with the other vaccines. Those utilize different technologies and platforms. So there are a lot of moving parts in this, and it's difficult to be precise in a prediction.
Jerome, what are the ifs in your business?
Well, I wanted to actually go back for a second to also note that Clear is not just deployed in sports. It's deployed in location-based event and entertainment areas. So we have also concerts, festivals, casinos, conventions, colleges and universities, healthcare space, hotels. So there is a much larger ecosystem around where Clear is adopted. So if you are a sports team and you're offering Clear for your guest, what you're really also offering your guest is entrance into a much larger ecosystem where that same platform, that one validated identity, can then be used to unlock all these other areas.
Good plug. You learn well from the NBA entertainment folks. But you know well, Jerome, we don't just keep sports in that sport bubble. Sports and entertainment. We cast that wide net.
That's right.
We get it. So Celine, for the sports team owner or executive that's on the call or on this and listening, what's the takeaway? What do they need to know? If there's one thing they need to know right now, what is it?
I think we're looking at masking for the foreseeable future. I do think that is the reality. That is something that public health officials are going to be asking people to do through the summer. And I think, again, on the vaccine hesitancy front, the more that you can do to enlist your players, and again, it's not just PSAs. I can't emphasize enough the value of these two-way conversations with people in communities. That really can have a huge impact on how people view the vaccines and have confidence in the vaccines.
All right. Well, Celine Gounder, Jerome Pickett, thank you so much for joining us. We really do appreciate your insights into what we're trying to solve for the sports industry, because we all love it, right? I know Grant is sick of watching just on TV. When can we get to a stadium and see a game? Thanks so much for the insights.
Thanks, Scott.